Okay, so good morning. So I'm gonna perform a cough management and at the same time perform oral cares. So first and foremost, make sure we check the patient's chart. Make sure we obtain any relevant information. Once you're about to go inside, gather all the supplies that you need. Make sure you wash and sanitize your hands. Wear appropriate PPE such as gloves, masks, and an eye goggles if possible. Once you're inside, make sure we greet the patient, check the patient's ID band for confirmatory purposes. Reposition the patient, had the bed elevated, obtain vital signs, make sure you explain the patient, let them understand what you're trying to do, and then after that we can proceed with the oral cares. So with the oral cares, we have a suction bottle in place, should be attached on the wall with a pressure of negative 100 to negative 120, especially for adults. We have here a Yonkers suction. So in here, make sure we remove this cover, try to suction the patient's oral airway. Make sure we try to remove all those secretions so that way the patient would not aspirate. And then if the patient is on ET tube, make sure we try to clean it up on the sides also, especially those secretions that just stick on the tube. Make sure also you try to move quite a bit the ET tube carefully so that way we prevent the patient from causing any sores, but take note of the lip level. So after cleaning it up, put this on the side. And then we have here another set of cleaning materials with a moisturizer on it. Insert this one on this thing. Make sure you try to put a certain amount on it, but not too clump at all. Make sure you clean it on the sides, on the gums, on the tongue, on the back of the tongue, and make sure you include it all the time the mouth to make it moisturized. So this one, it should be disposed except for this. Especially put this in the clean, safe area with the Yonker. And then after that, we can proceed in doing the cough management. With the cough management, the reason is that we make sure the patient would have a seal on the lower airway and then protect the patient's airway from any aspiration. We have to perform two types on it. First is the minimal leak technique and minimal occluding technique. Make sure we have a stethoscope. Make sure we place the stethoscope on this side, on the neck. And then we first have a syringe, a three-way stopcock, a gauge, and then with this ET tube, assuming. So with the minimal leak technique, carefully remove tiny bits of air, not too much until such time you hear a gurgling sound on your stethoscope, and then that means there's a leak that you take note on it. Make sure you check the gauge, make sure you take note of the pressure, and then after that, immediately try to push this syringe so that way we do the minimal occluding technique to get rid of that leak. And then make sure you take note of the gauge, and then when you do the minimal occluding technique, that means the gurgling sound that you've heard earlier is being disappeared. So after that, another thing to take note of is that when doing this cufflator or insufflator, which is commonly used right now, so this one you have to insert it directly to the balloon, and then we have here two attachments. So this thing is you have to press it up to take note what the appropriate pressure is at, if it's too low or if it's too high. So if it's too high, we have to adjust it through this red button. Carefully press it up, make sure that the pressure is about 20 to 30 centimeters water, not more than 30. So once everything is done, so which is here, so you see we maintain a patent seal on the lower airway. So once you're done, make sure we reassess the patient. Make sure we try to double check the lip level, listen to the breath sounds, make sure the patient is comfortable, obtain vital signs, remove PPE. Once you're about to go outside, wash your hands and document what is the amount of pressure you're able to get.